agonists and antagonists. Even in the absence of ligands, a fraction of receptors can be active. This gives the receptors a basal activity. Now, what happens when ligands are present? Ligands could activate the receptor to increase its activity or suppress it to reduce the activity. Those that activate the receptors and produce a response above the basal activity are the agonists. The ligands that suppress the basal activity are called the inverse agonists. Among the agonists, ligands that produce a maximal response are called full agonists. If the response is only submaximal, even when receptors are fully occupied, the ligands are called partial agonists. So, are there ligands that bind to the receptor but have no effect on the basal activity? Yes, but then why would we need such a ligand? One purpose could be to block the effects of the agonists. In other words, these ligands can be considered anti-agonists or antagonists. But then partial agonists and inverse agonists can also prevent the effects of full agonists. So isn't this also antagonism? Yes, but as seen earlier, partial agonists activate the receptor above the basal activity and inverse agonists suppress basal activity. So the ligand that opposes the agonist but has no effect on basal activity is more appropriately termed a neutral antagonist. Now, let's review the definitions.